Did you know that the therapy you provide in December is fundamentally different in its structure to the therapy that you provide in January? Something really interesting is going to happen over the course of the next couple of weeks because our Medicare system is built around the calendar year. If a client is referred to you today on December the 3rd, they have up to 10 sessions that can be used over the course of the next 30 days. Theoretically, you could book them in every 2 days and do intensive psychological therapy with them. But on the 1st of January, something is going to change. Suddenly, that client who's coming in for their first session has only 10 sessions to last the next 365 days. That is going to change the clinical decision-making process that you as a therapist will undertake. Suddenly, people will start thinking about, how do I hold the client? How do I manage their safety? How do I mitigate risk? Rather than, how do I work to alleviate their symptoms? But what does the research say about this? Are we better off spacing out our therapy sessions, or are we better off working intensively on a specified problem? The data is actually pretty clear. There is not a lot of evidence to support the idea of spacing out therapy. Spacing out therapy is valuable in terms of managing risk and in terms of mitigating some of the negative things that are going on in someone's life. However, if that's your goal, you really have to ask the question whether once every month, excluding January and February, is an adequate dosage regime to serve as that safety net. In fact, what the research data suggests we should be doing is choosing small and achievable goals that we can achieve in short bursts of intensive, probably weekly therapy. Now, I can hear the question, but what do you do for the person who is suicidal and is going to continue to be suicidal or at risk in some other way over the course of the next 12 months? Our government, in their wisdom, hasn't answered that question. All we can do is to fall back on the other safety nets that are available. Public mental health, counselling, the head-to-health centres, Medicare locals, or PHNs as they're now called, are also a port of call. However, whether private psychology resources should be used to maintain people in their state of unwellness, we really don't have the evidence to support that. It's one to think about as we go into 2025. Sit down with your supervisor and carefully think about, how are you going to manage the needs of your clients who have chronic and long-term mental health presentations? Because I would suggest long-term holding therapy is not the right answer. Good luck and have a wonderful Christmas and New Year.